Hello, Jim Howard here in Fort Worth, Texas. Today's date, ooh, is this Friday the 13th? Friday, no, it's Saturday. Okay, so it's safe. I'm not superstitious at all, but a lot of people are. It's crazy. Is it the same thing in other countries? Like, uh, like some buildings do not have a 13th floor. Of course, they have a 13th floor, but it's not listed as a 13th floor. I guess it must go 12th, 14th. And on elevators you get on and there's no, 13th floor because of superstition. I'm sure, of course, in other countries and other, uh, what would we call it? I'm sure probably maybe in some country maybe 7 or 6 or something, an unlucky number or a lucky number, stuff like that. But how did I get on this subject? Oh, okay, today's Saturday, November 13th of 2021, and it's 6:30 a.m. in the morning. I just woke up. Well, actually, I woke up and then I saw this story, and then the ex-wife was on her computer in the other room, so I went in there. I've been talking about politics and economics and Medicare and that kind of stuff. There's this story on CNN. U.S. announces big hike in Medicare premiums. Here in the United States, Franklin D. Roosevelt back in the 30s uh, came up with Social Security. And Franklin D. Roosevelt was a Democratic president. And Republicans' heads exploded. They just went crazy at just, having a retirement thing for people, for people who worked X amount of money would be coming out of their paycheck and would go into, the government storage plan for it or whatever. And then when they got to be whatever the retirement age was, which back then very few people would reach the retirement age, then they would get, a pension. And then, of course, changes were made by the Democrats over the years, and the Republicans never, they would just foam at the mouth. It just went against their grain. And Democrats made, like, I'm not sure when, I could look it up, but things like if a young person, let's say a young person gets married, we're talking a real young person, they have a baby. And if he worked and say she's not working, that's the way it was in the old days, Husband went out to work, wife stayed home, took care of the kids. Of course, like my father, his, mother, well, he was one of 7 boys and 3 girls. So he had 6 brothers and 3 sisters. And that's the way families were, basically back then. Things changed, over time. But the Democrats, like the Social Security system, retirement system that was set up over years, they modified it a little bit in different ways. One way was, okay, say a young guy gets married, they have a baby, mommy stays home, and he goes out and works. Now, if he works X number of quarters or something, if he works a certain amount of time, it's not like he gets a job and he makes a payment, of course it comes out automatically out of his paycheck, but it's not like, okay, he works a couple weeks and then he dies or is permanently disabled, he falls off a building or something. That's, I worked as a boilermaker. I worked at a Texaco refinery in Convent, Louisiana. While I was there, one of the workers, fell off of the thing and died. I worked second job, I think it was. No, maybe fourth or fifth job. I worked for the Darby Corporation as a welder building railroad cars. And, well, I worked for them before. That was my second job. I worked at exactly a year. I quit on my anniversary date because it was so cold, when it was cold or hot, or, it was not inside a building and that kind of stuff. And it was just, I got where I was like, okay, I'm going to go into work today. And then at noon, I'll quit. And then I go in, okay, I'm already, of course, I wasn't working at noon. I worked the evening shift, But, okay, I'm already here, so. And finally, when I realized, okay, wait a minute, this is my anniversary. You're exactly 1 year. So when I went in there, then I worked, and then I said, I quit. But okay, a couple of jobs later, same, I worked post office, different. But worked at what they called the shipyard, because during World War II, landing craft were, built there. And there, one of the workers, his job was, they had a railroad tracks, of course, with a giant, crane on it that could pick up, gigantic. And his job was to, whatever. Well, he fell and both legs and an arm were cut off. So things happen. Anyway, the Democrats changed Medicare, Social Security. Man, hard being a communist, isn't it? I'm kidding. Remembering all the benefits, because Republicans have always, Medicare, Social Security, anything for the people, is communism. But, okay, take these, people. If you work long enough, you get an X number of quarters in, or whatever it is that you've worked. Then if you're that young man whose young wife stays at home with the baby or whatever, if he is permanently disabled, and I mean you have to be permanently disabled, or if you die, X amount of money will go to the, I'm not sure exactly if it's to the, at least it will go, I know for sure, until the child reaches 18 or something like that. And I think it would go to the ex-wife also or something. Can't remember. But things like that were made, but the Republicans just forever hated Franklin D. Roosevelt, and so upset with him and with the Democrats. So, Social Security is, like, I worked all my life, and even part-time job when I had a full-time job, stuff like that. So every hour that I worked, the employer paid me X amount of money per hour, but they would put X amount of money into Medicare, and Social Security, and as insurance, as like having an insurance program, and we're having a retirement program, and that's just the way, just the way it worked. And finally, the Republicans had to. I mean, they had trouble getting people elected, and it was just they were. I mean, like zombies or whatever. They just, Social Security and Medicare. They just could not, and they were honest about it. I mean, of course they said it was evil and all that kind of stuff, but they were honest that they hated it and were going to destroy it the first chance. But they had trouble getting people elected, especially presidents, who had to. But eventually, at some point, and I had blogged about it. They came out, oh no, we're not, And if you went back in the newspapers or any type of records or whatever, you'd see that the Republicans had absolutely nothing good to say about health insurance for citizens or retirement fund for citizens. And but then they came up with, and I think it was really. Might have been somebody before President Bush, the second President Bush. I remember the second President Bush, and saying, "Oh no, we're not against Social Security." What? You're not? You could go back for what? 50, 60, 70 years or something, and every day they. But then their thing was, oh no, we want to protect it. It's unstable, and then of course their thing was, okay, well the money's not going to be there for people, so we need to protect it, and the way we need to protect it is, we need to have the banks take all this money and the stock companies take all this money. And it'll be like an investment for you, run by the stock people and the rich people. They'll hold your money, and then they'll decide how much you get or whatever. And I knew several people who were, smart people, smarter than I am, and they thought, and they were like liberals, and they were like Democrats, and they thought, I don't think the money is going to be there for me, because the Republicans have been saying so much about how, how unstable it was and all that kind of stuff. And of course, I had blogged about, no, it's not unstable. All you have to do, the money's there now. It's been there forever, and it's going to be there in the future. And the American people are going to make sure it's there. And what do you need to do? And I just outlined, without doing the math, actually, I just outlined, In fact, you'll probably find it on a video or whatever. Here's what you need to do. Right now, I think there's all employees or people pay into Social Security retirement plan. But I don't know, 200,000 or at some place, you don't pay into it. I mean, you paid up to, you're paying up to 200,000 or whatever the number is, But above that, well, you don't pay, you don't pay anymore. And I said, well, okay, I haven't done the math, but okay, you pay whatever it is, 6% of your pay goes into that, and the other, Social Security and Medicare, whatever. And your employer pays in the same amount. And when you get retirement age, or if you have some type of catastrophic, you die, your little children will be getting money until they're, adults and whatever. But above, let's say 200,000, maybe it's 400,000. I don't know, but I think it's a lower number. Okay, your employer, my employer pays 6.1%. Let's say 6%. I pay 6%. They take 6% out of my paycheck when I get it. The employer pays 6%. That goes into the fund. When I get to be 65, they actually changed that a little bit. I think it was 65, but depending on like your age, so I think that was always 65 was the thing. And I think when I got to 65 was when I could get Social Security and Medicare. But what I said was, all you need to do is and do it differently. Some people would say, well, no, everybody. I had friends that were really smart and were not some type of radical right-wing, who called everything communism and whatever, who said, well, yeah, I don't think that Social Security is going to be there. There won't be enough money. So just give me just turn the money over to me, which actually they weren't going to do. Turn the money over and put it in an account with my name on, which will be controlled by, Wall Street and the banks and that type of, they'll, and I was saying, no. I said, this is being set up for, and of course that's what happened. Well, not that the thing was passed, but that Bush was pushing it, and there was people that I knew who were smart that were saying, yeah, the money's not going to be there. So they're saying, give it to me, but they wouldn't have got it, whatever it would be. But anyway, I said, all you do, okay, let's say the top is 200,000 that people pay into. I never had to worry about reaching that amount, 200,000 a year or something. So I said, okay, well, don't do the 6% from the employee at that point and the 6% from the company at that point. Make it 3% and 3%. Really, as a liberal, what I would be make it 3% from me and 6% still from the, employer. And then I said, there's other, and I listed some of those. There's other things that you could, do like that. And there would be no problem with wondering, is the money going to be there? The money would be there. The problem would be, what in the fuck does the government do with this money that, where do we put the money that's coming in? We have way, way, way too much. That would be their problem. And there was other things that you could adjust. You wouldn't need to, but I would adjust those things at the same time, just to make sure, no doubt, because like during Trump's thing they sent out, I forget what it was that I got and everybody else got, some type of a statement signed by the president. I forget what it was. Was the something they were putting out, and it was like, okay, well, we're not sure that Social Security is going to be there, but here's some money from Trump or something. It was something like that. Something the government should not be saying. Oh, we're not sure that your retirement plan is going to, and just so there's Social Security, and now they adjusted that not to make it to the benefit of, they said, well, people are living longer. Well, I'm 80, so I'll get, and I wanted on proof, yeah. kind of the way it was set up before. I think it was like, okay, when you get 65, you're going to get, retirement. How many people reached 65 back in the 1940s, or the 50s, or so then you have Medicare. God, how can I think I don't even, for people outside the United States, I don't even need, I think you all know that we have good medical care, but you can't afford it. And even if you have savings, and if you have a really, really good salary or job, and if you have income coming in from stocks, or no matter what it is, you can't afford the medical care. Other countries, their thing is set up like on, taxes, employee taxes, and then when it's time for you to retire or whatever happens, if something happens, you're taken care of. You don't have to worry. You don't have to, if you have to call an ambulance, it's not going to cost you $1,000 for the ambulance to take you down the street. If you have to, go in for something, it's not going to cost, the emergency room visit for a cut finger or broken finger or whatever it is isn't going to be, $20,000. If you have some type of cancer, it's not going to cost you, $600,000. It's those things are be taken care of. So you have Medicare, or you have Social Security. Okay, Social Security. Let me leave Medicare, the insurance part, aside for a little bit. I forget, I think a lot of Americans forget, like, okay, when they talk about in stories like this, oh, you're not seeing it, okay. When you see stories where they talk about, Medicare or Social Security, when they talk about like Social Security, they say, well, the average American who's on Social Security, and now it's not this is like a insurance program. It's not welfare. People who are getting Social Security every day that they worked, every hour that they worked, they paid into the fund. Their employers also paid in an equal amount into the fund. It's not a welfare program. Republicans try to make it like it's a welfare program. When they talk about it, they'll say, when stories come up or whatever about Social Security, they say, okay, well, the average American gets, and they give a number like $1,500 or something, or $1,400 or something like that. That's how much the average person gets. Every time they can, then like when there's a cost of living increase or something like that, they'll say, well, the average American who gets Social Security gets 1,000 and whatever, and they're going to get an increase of $70 or something like that. I just happen to be the person that number, hits. So what a lot of people forget about, and what even I kind of forget about, is if you ask me how much, I wouldn't actually know. I'd have to. I looked it up, by the way. On Social Security, and I worked, and when I got about 65, I took retirement and got Social Security. But I actually continued working for many years after that, which you're allowed to do. and I was getting my Social Security retirement plus what I was making. Of course, in the beginning, it was like what I was making, they were also taking out for, out of the, I was paying and they were taking out. But what I forget about, a lot of people forget about, is, like I would say if you would ask me, how much do I make on, Social Security? I'd say probably, I make $1,211 a month. Actually, I get more than that, but about $120 more. But Medicare or Social Security pays me that, but I'm trying to think of, I don't think I have the option of opting out. Oh, well, anyway. But right away, and they decide by law, or I don't know, Social Security, I forget, Congress, I guess. So let's say that, to round things off, let's say I get $1,500 a month in Social Security. They take, I looked it up, let's round that up. They take $150 a month out, and they use that to pay for the monthly Medicare insurance program. Now, keep in mind that myself and all the other workers, we were paying into Social Security for retirement, but also there was tax taken out from the employer and from my paycheck for health insurance. So all my life I've been paying into this program for when I retire. I'm paid at work for now some employers would supply you with medical insurance, for free. I mean, it's not free, you're working, but but then things got so expensive, and they cut down on the benefits and all that type of stuff. But so every day and hour that I work, all my life, I paid into the Medicare insurance program, and I didn't use that because I was already paying at work through another, in addition, to a thing which I could decide on the benefits and that type of stuff. The Medicare thing was you pay into it when you're working, and then you get to be 65, you have health insurance in addition to a retirement money coming in. You have health insurance. Of course, Republicans, they didn't like, Social Security, and they sure as hell didn't like, Medicare. But you paid into it. And I don't think I realized it until I got to be 65 or whatever. I thought, okay, I've paid in all my life for health insurance, which the health insurance of the Medicare thing, which I wasn't taking anything out of it. I was putting into the fund until I got to be 65 years of age. Well, when I continued to work afterwards, they were still putting money in, to it. But when I got to be, when you get to be 65, now that number they've upped, I think it was 65. That was the thing. It had always been like 65, but then with the cost going up, all this kind of stuff, the government changed it by 6 months, by a year, or whatever for people. So somebody that were a few years behind me got up. Well, they couldn't retire. Well, they could and take with a getting a little less each month. But is this as dull as I think it is? But so what I found out, and I guess a lot of other people probably found out too. Well, wait a minute. No, Social Security is, giving me money. That's maybe the only money I have coming in. Maybe I had other money coming in, but the Medicare program, they are requiring each month, whether you're working or not working, they're requiring a $148.50 a month. That's what it is right now. No, yeah, a month, yeah, for insurance. Well, things are really, here's the news story. U.S. announces a big hike in Medicare premiums. Okay, switch here. The federal government announces a large hike in Medicare premiums Friday night, blaming the pandemic virus, but also what it calls uncertainty over how much it may have to be forced to pay for a pricey and controversial new Alzheimer's drug. So they are raising the amount. Right now I pay, and everybody else pays, $148.50, which I have automatically taken out of my Social Security, my retirement fund that comes from the government. Actually, it doesn't come from the government. I mean, I paid into it, and my employers paid into it. But anyway, so it's going up to $170.10 in January. The cost of living, everything is going up so much. For the first time in, 30 years or whatever, we're getting people on Social Security, or we're going to get next in January, we're going to get an increase of 6.1%. But the reason we're getting a 6.1, that's the amount that the cost of living has increased. And actually for older people, when they do the cost of living thing, you could probably do a thing on, if you're interested, on YouTube. How do they figure the COLA, the cost of living increase in the United States or whatever? And they'll tell you the story. They actually, I'm not sure that everybody has to, but they get the numbers in, how much fuel, how much gasoline costs, all these things. They have a certain list of things, and I don't think they actually still send somebody out with a grocery cart to go in a grocery store and take the items off the shelves, but I think they could come up with but that's the way it's supposed to work, and it's a certain list of items. Unfortunately, old people, we have to pay more for for the products. People who live in like poor neighborhoods maybe don't have access to, or really, maybe they don't have transportation, whatever, and you don't have access to, here we do. And now by the way, with Walmart and Kroger's and all kinds of stores delivering, stuff to our door. Thank God we don't have a car. Thank God I'm not able to, my ex-wife and my grown son, live here, and my ex-wife is, wheelchair bound, and so we can get groceries delivered. But there are people who live in, bad neighborhoods of the thing where they don't have a grocery store, a Kroger's or a A&P, and I'm not sure A&P exists, or but they have places that are small and charge a lot of money when you go, when you go in to get something. We have access to, there's a place up the street that's it's a private, it's not a Circle K or someplace it's like a private, place. I mean, they're not a part of a chain or anything. And the things up there, half a block up there, of course, I wouldn't be able to make it walking half a block up. It's up a hill. But the items, everything in there is really expensive. Well, no matter what it is, it's expensive. And I'm sure they have to pay, I'm sure they're paying more for it too, because they're not part of a, Amazon grocery store thing. They're not part of a Walmart grocery store thing. They're having to have small amounts, delivered, and but so people are paying more, and here on top of this, now my mother had Alzheimer's. They say she died of Alzheimer's. I guess. I don't know. I have a problem with this. The price is going up, and it's because of, they're saying that they're concerned about an increase because of this new medication for Alzheimer's. That there's going to be a large hike in the Medicare premiums because of the virus, but also because of uncertainty on how much that they may have to pay for a pricey and controversial new Alzheimer's drug. Okay, I don't want to sound like a communist here, but okay, what company makes this Alzheimer's drug? How much are these drug companies, how much are they paying in taxes? How much are they paying in taxes? Did I say, or did I ask, how much are they paying in taxes? And the drug companies, the people who make my water pill, which I need to take, or the people that make my naproxen, which I need for, and I have I don't have it here, but I have a whole list of medications that I have to take: heart medication, blood pressure medication, diabetes medications. And if these pharmaceutical companies they're taking in, here's the money for the everything, and they're taking in all of this money. Now I'm not saying this is not my area of expertise, but the government should just, okay, well, you charge so much for because they charge, the government will say, well, we had to develop this medication, a company that they all sell, aspirin, which is, cost them probably nothing. There's no research involved in, And there's a whole bunch of things like that. And I'm not just saying, I mean, let's get some good people on both sides. And let's say that XYZ pharmaceutical company, let's say that they get, when somebody from hospitals and everything, they, for patients or whatever, that for medications, we have to buy their medications. And we're spending tremendous amounts of money going into them. If we weren't buying their products, they'd be out begging on the streets. So, okay, let's take the XYZ Corporation. They have this new, let's say, I don't understand, but let's say this new Alzheimer's drug, which may work, but it is going to cost they give the number here, it's going to cost an astronomical, what is it, $10,000 a year or what, for treatment, just for treatment, here, okay. Some people are saying that this new Alzheimer's drug is going to cost $56,000 a year. Okay, I'm sorry. We're not taking you over. The government isn't taking you over. Not sure what context you would put it, but okay, let's say the XYZ Corporation. They have this, and it's going to cost, for people who need it, $56,000 a year. And believe me, my mother had Alzheimer's, and I worked hospital security for 30 years, and I had to run out in the parking lot or respond up on the floor, or combative, Alzheimer's patient, and keep some Alzheimer's patient from going out in the highway and walking in front of a car. I've had a little bit of experience with it, not financially or medically or whatever, but okay, XYZ Corporation. Okay, and you're owned by stockholders. Okay. Going to nationalize you. That's right, we're going to take you over. But the CEO and all those people, that are making $500,000 a year with stock things, all that kind of stuff, you can keep your job, but we're taking you over, and so there are stockholders. Okay, you're not going to get, because that money is coming from people who can't afford it. It's coming from Social Security people on Medicare and Medicaid and all that type of stuff. We're just taking you over. But the stockholders, you still have your stock. I don't know, maybe you were making X amount of money on your stock every year. A lot of money, but that's going to be changed. Your stuff, your money's not being taken away from you. You're still going to get money, but I don't know what the payout would, but that all that stuff would have to be. But now, and I don't understand, finances or whatever. Yeah, okay, I guess the price of the stock. Okay, you got stock, and because money is rolling in, and these pharmaceutical companies have so much money rolling in, they don't know what in the hell to do with it. It's just pouring in. They're still making big profits on aspirin and everything else, but they talk about, Tylenol company, and not Tylenol company, but the Tylenol, all those kind of stuff. they're saying, oh, we had to develop this very expensive new medication, and oh, it cost, so much to do that. Well, you're still making how much from all these other medications that you have made the money from them 50 years ago or more. So I'm sorry, go in and start with one, okay, start with, I don't know the situation, you have to pick the best fight, whatever. And I don't know, maybe this company that has come up with this new medication that's going to cost $56,000 a year, maybe that's the only product they have. I doubt it. How could they afford to, develop it or whatever? But just send the word out that times have changed and things need to change, and then the other pharmaceutical companies, just tell them publicly or privately, okay, look at this. And, look at this guy who was making $500,000 a year and he's getting stocks. He's getting stock in addition to that. And if he does a lousy job and gets fired, he gets a golden parachute of, blah, blah. Look at all this stuff. It's easy to, look at and come up with the information, This is crazy. This is insane. This is highway robbery. This is piracy. Look at it. No more. Here's the way it's going to be. And for the rest of these pharmaceutical companies, put your big boy pants on, because there's a new sheriff in town. So, this new, I think this is the biggest Social Security increase in 30 years, 6.1%. But that's the cost of living, and the cost of living for people that are older or that are handicapped or that, whatever, we actually pay more than, if the thing is figured at 6.1%, we spend more than that, actually. But we're grateful we can get that, but then, man, to be hit by this extra, going from 150 to 170 right there for Medicare. So I'll put a link to this. Well, maybe let's just scroll down here a little bit. Well, I don't know. It's something you're probably going to have to read if you want to. Now, this is something that I think other people too, totally forget about. I get the average Social Security amount. When they news media, they say, oh, the average person gets, 1,500 a month. But the lowest amount that somebody can get on Social Security is $365 per month. Now, the way this thing, works is this medical insurance. If these people want medical insurance, which they need, probably more than anybody needs, they have been paying $150 a month, and they're going to have to pay $170 a month. And there are people who only get like $365 a month. Uh, I'm looking at this, and by the way, I think I already mentioned this is going to hurt President Biden, but really President Biden, none of the presidents, and not just the President Biden. So far as the economy, we all do it. I do it too. Well, Trump is president or Bush is president or whatever, and the economy is bad or whatever. Presidents really have just about zero effect on the economy. Now Trump did, because Trump did some stuff, like tariff, things that caused, China to retaliate, and he did a bunch of stuff. You can do a few things, but in general, the unemployment rate and things like that, presidents really, we all think they do, and it's natural that you would think he's the head of the country, Although we have executive branch of government, we have a judicial branch of government, we have a legislative branch of government, and then we have private industry and all that kind of stuff. Let's see what else is on the. I'm afraid to look. I actually woke up a few hours ago, I think it was, and I haven't had any breakfast yet or anything, I don't think. But let's see what else is, because this is like the first thing that popped out at me. I'm on Social Security, and Medicare. See, Happy Days, the oldest Cunningham son, dies. I watched Happy Days a little bit because back then he didn't have as many choices. Oh, okay. I really don't remember him. Died at age 70. He died in his prime of life. That's sort of a joke. There's a TV show from the UK. I wish they would make more of that show, but I think they only did 3 seasons and weren't many. Derby Girl, or the Derby Girls. I think it's Derby Girl. And I just watch it because it's young girls in Catholic school uniforms. I'm kidding. But in there's a situation where a nun dies who's 97 or something like that, and the head nun, is like, oh, we have to do an investigation. We're going to do an investigation on her since she died, like unexpectedly. And one girl, Derby Girl, says, she didn't say what in the hell, but what do you mean you're doing, she was, she was 98, years of age, that's why she died. Anyway, the girl's parents are there, and some other kids' parents are there in the meeting, and the one girl's grandfather, is there, and I don't know how old he is, maybe in his 80s or something. I'm 80, maybe he's in his 80s. Anyway, when this girl says, well, she was 98 years old, and the girl's grandfather says, yeah, she was in the prime of her life. So it sort of just depends on your perspective. Let's see what else is in the news here. Family health care coverage at work tops $22,000 a year. Family health care coverage at work costs $22,000 a year. Family health care coverage at work. Let's see. Getting family health insurance on the job now costs workers and their employees more than $22,000 a year on average, and companies have not been able to do much to make coverage more affordable. Every employee foots about $6,000 of the tab, while companies pick up the rest, according to the Kaiser Family Foundation. Yeah, when I started out, working about 1959 or 60, health insurance medical things weren't nearly as expensive as they became, and health insurance then also wasn't, but then it started being supplied, and then it was, it was reasonable if you were working, depending on who you were working for, but and then when insurance came along, health insurance, if you worked a good job, hospital security, say, it was, I think it was like free. And then before long, it was like, okay, well, you'll be paying X amount each month, and it didn't seem too bad, but it just kept going up, and then it got where the cost just skyrocketed. I've been putting myself to sleep. The COVID numbers don't bode well for winter. I need to get my flu shot, and I've had both of my COVID-19 shots, but I need to get, the third one now. Next week I'll try to start, getting on a list or whatever. Massachusetts students will walk out to protest a racist video by white classmates. I'm not even going to look at that, Hollywood prom queen could be dating the class clown. Oh. Oh. Less than a month after this guy rode into space with Captain Kirk. He died in a plane crash, a 4-seat plane. He was a pilot. And there he'd gone into space as a passenger. Some people need, I don't want to sound like but I think John F. Kennedy, Jr. or whatever, got a license took off with some family members. He really should not have been flying. He didn't have enough experience. I mean, he had enough. He was legally allowed to do it, but he didn't have and even the type of situation he was in, even really experienced pilots have a problem, and they need to work and be aware of the type of problem that you have. That's something that's very common, and I don't know if you can afford to own an airplane and afford to get a pilot's license. Of course, there was somebody riding with him. I don't know. Okay, let's go up here, see what we have. God, I don't want to see a thing of Trump scores legal victories. Okay. I don't even want to read this story. The Rittenhouse judge is considering lesser charges. This guy was not old enough to purchase a gun, so he had a friend purchase a assault rifle. Don't give me the crap. Not an assault rifle. Okay, come on. Let's not go through that crap. So this guy was a juvenile, and he had a friend, which they call that a straw sale. It's illegal, and usually the penalty is pretty stiff. If you buy a gun for somebody, you go and sign or whatever that, I'm buying this just for myself. Here's my identification. I'm not purchasing it for anybody else. And usually when you sign off on that, if you are buying it for somebody else. So anyway, he bought this for, I think, a 17-year-old. And then the 17-year-old went out to a protest against, there were people protesting, and he went out to protest the protesters or something. And shot 3 people, and 2 of them he killed. And I'm surprised that he took the stand. Usually, somebody in a situation like that, the defense doesn't want them getting up on the stand testifying. So I'd kind of like to know, just out of curiosity, why they decided. Was it because he was a young white boy? He was a man, but well, I don't know. Let's see. Mother of 14-year-old girl who went missing for almost a month is arrested. The mother of a 14-year-old girl was found safe in New York City on Thursday. The mother has been charged with 2 counts of second-degree endangering the welfare of a child. The charges against Jamie Moore, 39, include allegations of physical abuse and neglect. The 14-year-old and Moore's 3-year-old son have been taken from Moore's custody. The teen was found safe in New York City. She was last seen at a deli near her home in East Orange, New Jersey on the morning of October 14th. I don't understand. Oh, wait a minute, they're going on. Okay, it's gonna. I don't understand. I don't even want to know. It's going to be sad and stupid and everything else. Rittenhauser, that's the young man who went out and shot 3 people at a protest. His mother gives an eyebrow-raising interview on Fox News. Okay, I gotta. You gonna make me watch it?
And Kyle Rittenhouse's mom raised some eyebrows last night in an interview on Fox News. Here's this exchange.
Have you and your son discussed whether or not, if he had to do it over again, he would go into a situation like that?
With Kyle, I know him, and he probably would do it again because that's the type of person he is. He always wants to help people. Even since he was a little boy, that's all he wanted to do was help people.
Presumably the jurors are following instructions. They won't see that.
Wow. Wow. I'm not sure what the went out there with an assault rifle, to shoot and kill somebody, and she thinks that's helping people. I guess he was going out there to shoot protesters, people who were protesting against the police brutality or whatever the situation was, and she thinks, but she should keep her mouth shut. Okay, I think that's it. Thank you very much for watching. Oh.